If you're considering medical cannabis, talking to a healthcare provider may be daunting.
Hi, I'm Matt McIff, and I'm a qualified medical provider. I'm also an MD, a family practitioner, and I work for Intermountain Health. I'm here to talk to you about medical cannabis.
Is medical cannabis legal in Utah?
Under Utah law, a QMP can authorize their patients to use medical cannabis for qualifying medical conditions. If you're 21 and over and have a medical card issued by a QMP, then it is legal to use cannabis as a medicine. But remember, cannabis must be purchased at an approved pharmacy, and it's still illegal to smoke it. Medical cannabis is not yet FDA approved. There's some evidence that supports its use for select or several medical conditions. Will it work for you? Well, that's hard to say. It's a very individual treatment and requires a trial and error process, working closely with a QMP. For people under 21, medical cannabis is authorized on a case-by-case basis, and there's a process for that. QMPs and pharmacists are operating in full legal compliance with state law.
How do I find a QMP?
Go to medicalcannabis.utah.gov to find QMPs in your local area. You will find their contact information and a little bit about their practice. When you're ready, you can call and make an appointment. You may also consult with your primary care provider.
How should I prepare for my first appointment?
Do some research. Medicalcannabis.utah.gov has some excellent resources about how cannabis works and the qualifying medical conditions. Take some time and think about what you want to accomplish with medical cannabis. It's not a cure for any disease, but it can treat symptoms of qualifying medical conditions. So setting goals of therapy might really help your discussion with your QMP. Some examples might be trying to reduce your dependency on pain medication or treat your pain more effectively, or treating muscle spasms. Whatever it may be, think about what goals you want to accomplish and be ready for your appointment.
What should I take with me to my first appointment?
Bring a list of your medications and supplements, as well as your past medical history, especially what is relevant to your qualifying condition.
What will that appointment look like?
By law, medical cannabis consultations are face-to-face. Please expect to meet with your QMP for 30 to 35 minutes. Our appointment will be focused on determining if you have a qualifying medical condition and if you have any contraindications or reasons why you shouldn't use cannabis. Be ready to answer a lot of questions in a short amount of time. Questions about physical health, mental health, prior experience with medication or cannabis. That's a lot of important information the QMP needs to know. Some of these questions might ask personal information or about emotional health or prior experience. We might ask about PTSD, for example. These are difficult questions, but they are important for the QMP to know. Is this the time to talk about politics of cannabis law? Probably not. There's a limited amount of time, and it's important to stay focused on your health.
What should I ask in the appointment?
This is a patient-involved approach. Ask questions. Consider writing them down before the appointment and bring them with you. Be sure you ask about the risks of cannabis use. There are some, including the risks with driving. Other risks may be different depending on your situation or condition. One risk of using THC, a component of medical cannabis, is developing physical or psychologic dependence, leading to cannabis use disorder or CUD. Following up regularly with your healthcare provider or your QMP is the best way to prevent long-term harm. We are learning more all the time about medical cannabis. Ask your QMP how you can keep up on the research. You and your provider are learning about medical cannabis together.
If I'm approved for a card, what happens next?
If you qualify, we'll help you register with the state electronic verification system. The card is digital. This isn't going to be a typical appointment where the provider gives you a prescription to take to a pharmacy. Your QMP will leave most of the dosing recommendations to the clinical pharmacist. There are 15 cannabis pharmacies in the state, staffed by knowledgeable and helpful pharmacists. They will help you learn what to buy and how to use it. They will be your best resource for adjusting your dose and dealing with possible side effects. You can find a list of these cannabis pharmacies on the state website. With dosing, it's always a good idea to start low and go slow, sometimes very slow. Don't adjust your dose rapidly. Initially, wait at least 24 hours before adjusting your dose. Your QMP will work with you on follow-up intervals. It may be 1 month or 3 months, but your card is activated annually.
What should I tell my primary care provider?
Technically, your QMP doesn't need your primary care provider's permission. However, for pediatric patients or other special cases, it's important for your QMP to contact your primary care provider. It's usually a good idea to involve your primary care provider at some point in your therapy, especially to let them know if you're making changes to your medications.